Nurses and doctors of Reddit, what is your they never taught this in school moment? This one was fun. Patient in a gets a standard urine drug screen. Positive for ethanol, alcohol. Patient insists he does not drink alcohol. Test is repeated. Positive. Patient is very upset. He does not drink alcohol. Blood test is drawn. It's negative. We checked everything we could think of. Did we have the right urine? The right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis. High white blood cell count, and really high glucose. Elevated white cells means you need to look at it under the microscope because they probably have an infection. It's loaded with yeast. The man was diabetic, obviously, and had high glucose, sugar, in his urine, along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. So that's how Bud Light got started. I was in my first year out of family practice residency. The specialists like to sneeringly refer to us as jack of all trades, master of none. I was on call from the air. Normally unshakable, the doc was beside himself. Had a very preterm mom in active labor, and fog wouldn't let us fly her out. He was the only doc, and the transferring facility wouldn't take her in transport without a physician on board. Probably not legal, but we needed her to be at a hospital with an NICU and L&D, so they called me. En route I was trying to coach her to breath through the contractions, but she felt something coming out. I looked and saw a foot. So we're in the back of an ambulance delivering a footling breech preemie. We delivered about a minute or two out of the hospital. They were expecting a mom in preterm labor, not a micro preemie. We were met in the ambulance bay by one nurse. She took a look at me holding the baby with a blanket and oxygen and said, "Follow me." We ran through the hospital to L&D and turned on an incubator. Peds wasn't in house and the baby's heart rate was low, so I proceeded to intubate her. That was 12 years ago. She survived and is doing great. I wrote my program director at 4 AM that morning when I got back home, thanking him for all the training. I think I used 100% of my training that night. I'm in a lot of preemie support groups, and this scenario sadly is very common. We need NICU stabilizing capability in every hospital. Mums call an ambulance and the ambulance takes them to a hospital without a NICU and a viable baby dies. All the time. For my GF, walking into a patient's house, home health, and almost being knocked unconscious by the smell of cat pee. The lady housed 25 feral cats but didn't let them outside because she was afraid the coyotes would eat them. Walked into a trailer house connected to a camper only to see the floor start moving. Realized it was cockroaches, not the actual floor. I'm a professional organizer. Same. A patient being treated for HIV purposefully tried exposing staff members to his fluids. That was a sobering experience. Nurse here. A very panicked nursing assistant came running to the desk one day saying, "You have to come see this." I don't know what this is. The NA brought me into a patient's room where she was giving a bath and points to an area on the patient's buttocks. What is that? I lean in for a closer inspection, when the patient starts to turn back around and says, "Is that my eye?" Sure enough, I didn't receive a report that my patient had a prosthetic eye which at some point came out of the socket and became suction cupped to her buttock. I left the room and had never laughed so hard in my life. Shame it's totally unethical, and on lots of other things. A pic of that would have been sensational. But I mean, totally wrong of course. Nearing completion of an air contrast barium enema on an extremely elderly patient. Out of nowhere she starts saying, "Call Rochester Funeral Home. I'm dead, call Rochester Funeral Home, I'm dead." She repeated it no less than 10 times. Took care of a young man with a gunshot wound to the abdomen. He had many complications. He was in the hospital for over a year. He had an ostomy bag for a while, but when they finally removed it he was so nervous because he hadn't pooped in so long. His call light goes off and he says, "Go look in the toilet. You're never going to believe this." I go in there and there is poop in the toilet. His first solid poop I had seen in over a year. I walked out and gave him the biggest hug. He was so proud of his poop. I walked out of his room with tears in my eyes. Nursing school never prepared me for crying outside of a patient's room because I was so happy they had pooped. I really like this one. Small victories. When my mum was fresh out of nursing school in the 80s, She got a job at a hospital that had a high concentration of geriatric patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in, my mum and another nurse tried to put them back in so as not to horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely didn't prep her for that nightmare. Bro, so many things. I think one important thing that was never taught is how to deal with a patient dying for the first time. I couldn't stop picturing his last breaths, the yelling of his family. All of it played through over and over. Hospice is tough, but it still is one of my favorite jobs I've ever done. Oh man, I don't know how you did it. I have a lot of respect for you. My grandma screamed the worst scream I have ever heard in my life when my grandpa died in hospice. I'll never be able to get it out of my head. I had to leave. It was overwhelming. I don't think I could deal with that on a daily basis. How to put a fake eye back in. A patient came in from a not so nice nursing home with a multitude of problems, one of which was a disgusting, draining fake eye that had to be removed for treatment. Upon discharge, we had to put it back in. Simple enough we thought, but we had no idea how and struggled to figure it out. I suppose that is why the nursing home staff never took it out to clean it. This was decades ago. Fake eye technology is probably much better today. How to react when a patient's bowels pop out of their incision. This happened when I was a brand new nurse, but off orientation. Quite a learning experience, but came in handy because a few years later it happened to a different patient and I knew what to do. You have to keep the bowels very moist, cover with sterile gauze, and patient is rushed to the OR. LOL. One of my favorite patients at the emergency vet. Little spaniel chewed out her spay incision and her owners found her playing dragging her intestines through the leaves. Brought her in wrapped in a garbage bag. A whole team of us spent a long time in surgery just rinsing it all off. She got a ton of antibiotics and did great. When I was a student I accidentally degloved a patient from the elbow down. They were incredibly sick, probably already brain dead, and had one of the worst case of 10 toxic epidermal necrolysis I've ever seen. Anyway, I'm in there holding this lady's inside out arm skinned like an idiot, with the family standing in the corner horrified, and I just froze. My first thought was to kind of slide it back on, but thankfully one of the senior nurses rescued me and snipped that crap off. Women will pee and poop during labor, ribs crack during CPR, and it feels really weird. There is a market for amoxicillin amongst IV drug users. According to my patients, it's very common for somebody else to put C in their urine, and fentanyl is a sexually transmitted drug. Respiratory therapist here. How to act when we unplug the ventilator to let go a patient, especially when the family is around. To their defense, they do warn us it's going to happen, but it's never until you actually do it that you realize the weight. I like to talk to my patients even if most are already brain dead at this point, although I did have to unplug conscious patients. That was hardcore to say the least. This gives me a sense that at least if even a small part of their consciousness is still alive at this point, they know they're not alone. I tell myself that at least from now on they won't be suffering anymore. L&D nurse. The other day I had to give a steroid injection to a 27-week pregnant woman who was going into sepsis. Here's the thing. The steroids would develop her baby's lungs in the event she needed to be delivered, but they could also make her much more sick. Definitely the most intense shot I've given in my life. Last I heard she was doing better and still pregnant, thankfully. Student nurse here. How to hide looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him while he was putting a patient's prolapsed rectum back in. Awkward. Digital disimpaction. I can only imagine the partnering instructions for that. No one poop for 2 weeks then come to class and buckle up. The dead people can still fart. Middle of the night, all alone with the body, and you hear that. Scared the heck out of me. I was cleaning a recently deceased client once and her arm twitched whilst she moaned. Frightened the life out of me. They never really tell you how to cope with being berated by family members, patients, and even co-workers. Part of being a nurse means that you realize you are dealing with people at their most vulnerable, at the worst time in their lives, and you know this in the back of your head. But being an emotional, and sometimes physical. Punching bag for days at a time requires a certain mental toughness that you can never really prepare for. Had to comment because this is so true and a good explanation of why the burnout rates for nursing medicine is so high. How to sit in bed and hold your patient as she profusely vomits and delivers her 16-week-old dead fetus. Yes, they teach you that compassion and empathy are the backbone of nursing, but absolutely nothing can prepare you for this type of situation. I heard this story from a SLP. Always keep a clear exit. She was working with a stroke survivor, set her at the workspace, and walked around to the back of the table with her back against the wall and facing the door. Suddenly the little lady says, "I know who you are. You're the lady who has been sleeping with my husband." Suddenly this lady has lunged across the table and is legitimately trying to kill the SLP. Luckily lots of other people came when she screamed code blue. She couldn't think of anything else at the moment. I mean, code blue works even though that really should have been a code gray. All those things you encourage your patients to do, eat well, exercise, get enough sleep, etc. also apply to you. I know too many nurses who don't take care of themselves mentally, physically or emotionally in a very draining environment. Self-care is incredibly important and sometimes we'll lose sight of ourselves in trying to take care of others, but we're of no use to anyone if we're running ourselves ragged. From former boss. How someone looks at you when he tests positive for HIV after his wife died of AIDS because you were her doctor and you treated her for years. You were also his doctor. You knew she hadn't told him, and you knew that she was still having unprotected sex with him. WTF. On behalf of my husband, no one tells you how many low-income women will go to the ER, complain of abdominal pain, go through an exam and have different tests ordered because they can't afford a home pregnancy test. Not only this, but women who know they're pregnant do this because it's the only way for the health of the baby to be checked. What to say to a family watching you code a patient for 15 minutes and pink frothy sputum is exploding out of their ET tube while you're doing compressions. I was never taught about sundown syndrome until I was working with the elderly in a hospital setting as a student nurse. I had the sweetest elderly patient in my care until about 4 PM that day. He suddenly became possessed. He started screaming and hallucinating and was not the man I had been providing care for earlier. I was so befuddled when the nurse I was shadowing told me he had sundowners and explained it to me. Now it's your turn to explain it to us, please. Number 1 most memorable. Cardiac massage for 10 straight minutes while a guy was bleeding to death from multiple gunshot wounds. Had to stick my fist up though someone's left lung to locate the heart and to directly give them CPR. Literally pumping this dude's heart so it can keep circulating blood. Felt like I was doing a fatality move in Mortal Kombat. It was surprisingly small and very squishy. They never teach you to expect the unexpected. I got floated to the ICU on a slow day. They immediately gave me a patient who was violently hemorrhaging out of his mouth while all of family was inside freaking out with me. He died an hour later. Had 2 different patients come in with thighs big kitchen knives deeply embedded in an eye socket. They were both awake and talking. Enema parties are a thing. Inflatable penis implant surgery is pretty shocking but also amazing. Opening up a tumor cyst to find fully grown teeth and hair inside of it. The day a patient exploded in surgery and it splattered the entire team and room with this brown fluid. There's an alarming number of nurses and doctors who don't know what the frick they are doing. I've learned so much more but those are what I can immediately recall. Wait. I'm gonna need you to elaborate on the exploding person. So many things, here's what I can think of off the top of my head. 1. Sugar is used to put someone's prolapsed rectum back in. Sprinkle it on and let it sit, drawing some of the liquid out of the tissues of the rectum and just kind of push it back in. That was fun on the job training. 2. How to put someone into a body bag with dignity, especially if they're tall and or in an awkward position. 3. Fernie's gangrene. One day I was actually precepting a patient care tech when I was a nurse in the ER and had a patient ask me to help him dress his wound. This was not why he was in the hospital. Thinking this would be a great teaching moment, I called my tech in to learn how to do some wound care. She learned that day how to maintain an excellent poker face. 4. Never block your own exit out of a room with an actively psychotic patient. 5. How to comfort an inconsolable baby using a combination of low shushing in their ear, a somewhat aggressive swaying motion and some humming. 6. How to interact with patients and their family members on, sometimes, the worst days of their life. How to hold someone's hand when they've just gotten terrible news about their own or their loved one's prognosis. How to celebrate the, often few and far between wonderful news we get to tell patients. And then how to leave that room where you may have just told a family their loved one is dead. Collect yourself and go into another room with another patient and care for them like it's just another day. Nursing is a profession where you have the sacred honor and ability to be there for people on the best and worst days of their life. To be able to hold a life that is merely seconds old and hold the hand of someone during their last seconds on earth. That's not something that you can be taught in school. Patients having sex and or shooting up in the bathrooms. People coming in OD'd and then bouncing out the door as soon as they are conscious to come in OD'd again a day or two later, then repeating the cycle every week or two but somehow never dying. Patients who fake symptoms to get admitted for attention or to get a day off work or get hopped up on goofballs or whatever thing they are after. Delirious old ladies telling me to get out of their living room or they will shoot me. Any kind of self-harm. Patients coming in next to dead because they've been neglected in the prison system. If you have a patient in labor or in any painful procedure who wants to hold your hand, only let them hold 2 fingers. They can't squeeze them too hard and break the bones. They still get the comfort of human touch. I've had patients in labor pinch me, pull on my clothes and squeeze my 2 fingers as hard as possible. Some are just panicked but some seem to be angry and want to hurt someone. I calmly ask them to stop with the pinching or pulling on my clothes because that isn't helping them. These are often people who have refused an epidural because they are afraid of needles, and I understand that. I just am not going to be black and blue. I always teach the new nurses or students the 2-finger trick. This reminds me. Several years back had a couple in for delivery. Asked what method of pain control they preferred. They looked at each other, giggled, then he said, "She bites me." I asked for clarification, and apparently during her first 2 deliveries when the contraction pain became unbearable she would take his hand and literally bite the freaking crap out of his knuckle. They were both hip to this plan and oddly proud of it. Fast forward a couple hours and labor is getting well advanced. I look up from a vaginal exam in time to see her clamp her teeth on his calloused knuckle. She appeared to be biting with full pressure. He made a bit of a face but not a sound. And thus we ushered their youngest into the world. Contraction would start. She'd take a lungful of air and push to the count of 10 while biting the heck out of her man. It worked for them, so who am I to judge, but it made me somewhat uncomfortable. That 2 fingers idea is smart. I was working with this tiny girl that was in pain from stretching muscles and I had her squeeze my hands to help with the pain. I assumed that since she was so little, it wouldn't hurt, but dang, she could squeeze. It really put into perspective how much pain she was in from what seemed like a simple stretch. Book world and real life nurse world is completely different. I'll play along. They never teach you that your psychotic dementia patients will try to hit you. They don't teach you how to react, or don't, to a patient or family member or physician yelling at you. They also don't cover how to handle your mostly nonverbal, elderly, male patient inviting you to hop on and take a ride. Yes, he meant his penis. As a sonographer, I have to keep a poker face a lot of times when I am seeing something very alarming or sad on the screen. Luckily, most people have no idea what I am looking at, so that's a plus. I'm not allowed to give any results to patients. Doctors deliver the bad news, so I have to stay neutral. It's really hard. Had a patient with horrendous teeth. User. Couple of teeth fell out during intubation, so they sent him up with them in a denture cup. That was a real awkward conversation when he woke up. Anytime there's something up the butt. That time 100-year-old grandma broke her hip falling out of bed, but not her bed. On a more serious note, your loved one is dead phone calls. This is usually done by the doctors, as I feel it should be, but sometimes nurses do it. RN here. For me, the most surprising thing has been seeing firsthand how peaceful it is for a patient to be able to choose when and how they will die. I was present for the first medical assisted suicide on my unit. The patient had his loved ones surrounding him and we all watched as he said goodbye and shortly after took his last breath. In my area of nursing, patients get better and go home. I always viewed my work as a means to make people better. It has taken me a while to process his decision. It was beautiful and peaceful and really made me look at nursing in a different way. I care for people to help them live, but for this man I was able to support him through death. EMT here. Sorry to intrude. They teach you how to handle death. They tell you, you're going to have dead patients. You're going to see the ugly side of death that doctors and nurses don't have to see, because when they get the patient, most of the ugly is handled by you, so we need thick skin. But when you have to hold the hand of a kid less than 10 years old who says I don't want to die and next watch him slide into a no waking up sleep, it's freaking life changing. Frick me, I didn't want to cry tonight. Enough Reddit for today. I hope you're getting therapy or something. That's some heavy crap to carry. Sexually harassed by an elderly patient. The guy is 80 and frail. Was I grossed out? Yes. Was I threatened? Number. But they don't teach us how to respond to impotent harassments from hospitalized patients. Do I get a new doctor for him? What if that doctor is a woman too? Should I put up with it? I treat rude abusive buttholes every day. Why would this be any different? Still trying to figure out what I should do. This. They don't teach you how to deal with sexual harassments from patients. And it happens so much. They also don't tell you that if a patient physically assaults you, there's really not much you can do. Apparently pressing charges on a patient is tricky. If you hit me in the ear because you are drunk, I can't do anything about it. Yet if it happens at a bar, you can get arrested. As a nurse's aide we are just supposed to say I'll get the nurse for you when you get a real stumper. But when a dying patient or their family member cries to you they don't want to die, you can't get someone else to help them. You have to find the exact words to find in the middle of serving dinner and 5 call bells ringing off your hip. Probably the hardest situation in palliative work. My mother was a nurse who cared for elderly patients in a very rural part of England. Here's a few her favorite stories. One was a lady who decided to help clean the windows. She used the food from her dinner as soap and napkins. There was a fun mess to clean up. Another was 3 gentlemen who spent the night calling out for their wives. One was named Edie, one was named Emma, the other was named Elspeth. She said that was one of the longest shifts ever. Finally, she said most of the elderly men were completely clueless when it came to ordering their dinners. They would always say something along the lines of "that's my wife's job." She used to just order them the basic meat and 2 veg option and rarely got complaints. Whatever your granddad would like usually was the safest bet. My grandfather was a farmer. They never teach nurses how to manage expressions in unexpected or poor situations. I personally have no trouble hiding everything, but watching people around me and the patients themselves tend to ask me what's wrong with that nurse doctor. Me being able to keep such a straight relaxed face and expression helps everyone around normally. Being able to explain something bad without a panicked expression is an invaluable skill, which can definitely be taught. Though nothing can prepare you for some situations. I can say I can't remain relaxed with I see a high risk person self-remove a trash tube. When your patient has a crap the size and shape of a football stuck in their butt, and you have to use your finger to delicately scoop it out. When the doctor comes along and tells your patient they are dying of cancer, then walks away and leaves you to pick up the pieces. When your patient is 90 years old, has dementia, diabetes, cancer and comes to hospital with pneumonia. They are 30 kilograms soaking wet, nothing but a bag of bones who doesn't recognize themselves in the mirror, yet their family insists they are for CPR. OMG, that last one is the saddest thing. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.